morning, everybody. Thank you so much for joining today's webinar. My name is Carrie McClellan. I'm the Outreach Manager for ElderHelp, and I help to facilitate these family caregiving webinars that cover a variety of topics for anybody really who's interested in learning more. But I will introduce our speaker and the topic in just a moment. And before I do that, I will give just a brief overview about ElderHelp so that you know who we are. Our mission at ElderHelp is to support older adults and their ability to continue living independently and safely in their homes for as long as possible. That often comes with other support networks, whether it's family members or others in their life that are coming together to help make that aging in place successful and make it happen. We are excited to be celebrating our 50th year supporting seniors and their families in the San Diego community. So that's a really big accomplishment for a small nonprofit like ours. And we know that our work is not done. We hope to be around for another 50 years. At ElderHelp, we offer a variety of services directly supporting older adults and then also our family caregiver support. So we offer information and referral service to connect people with resources. We offer check-in calls. One of our biggest call programs is called Are You Okay? And that's designed to help people stay connected, make sure that we're checking in with them on a regular basis if they don't have many other people doing so. We have a transportation program called Seniors A Go-Go. It's done by volunteer drivers. We offer care coordination services through degreed social workers and a variety of volunteer services through that program, including grocery shopping, home safety services, etc. We have a housing service department that works to help San Diegans find affordable housing options and also roommate matches through our home share program. And we offer nutrition services through our grocery shopping as well as through pantry deliveries. Our family caregiving support program, in addition to the information and referral service, which is available to anybody who's looking for resources, we also offer these types of webinars on a variety of topics. We want to make sure that we're helping to educate family caregivers at whatever stage you're in. If you're just worrying about an aging loved one, if you're providing day-to-day care, there's often resources and topics that would be helpful for you in that process. So we're excited about offering today's topic on medications. We also have created 5 online courses that can help family caregivers walk through the process of what it means to be a family caregiver, how to create a care team, how to maintain self-care and make sure that you're taking care of yourself as well. We also have a course specifically on caring for somebody living with dementia, and then for working family caregivers, so trying to balance all of those things. We are so incredibly grateful for our partnerships with Southern Caregiver Resource Center and Alzheimer's San Diego. And today's topic, I look forward to hearing more about from our expert, Jean Alton, excuse me, and I will introduce her in a moment. But just the topic itself is something that comes up quite a bit when we're communicating with individuals. Medications are often, lying around the home. So many older adults take multiple medications, whether they're prescribed or they're vitamins. And so organizing those and having a way to do that is really important. When you are caring for somebody living with dementia, and I know Jean will talk about this, that adds an extra level that is needed to help make sure that those are being handled properly. So she's going to give us all kinds of tips today. And I am going to properly introduce her. So Jean Alton has worked in the field of Alzheimer's disease and related dementias for over 30 years. She has a bachelor's degree in psychology and in recreation therapy and is a certified positive approach to care dementia trainer. Jean's expertise is built upon her many years of experience working in a variety of settings, including memory care and facilities, adult social day programs, early memory loss programs, and care management. Jean is a senior dementia educator with Alzheimer's San Diego, where she provides community education and coordinates programs for people with early stage dementia. So welcome, Jean. Thank you so much for being here and sharing your expertise on today's topic, which is definitely an important one for all of us to learn more about.
Thanks very much, Carrie. I'm always very happy to partner with ElderHelp and come in and do these webinars with all of you. So let's get started. We have lots to talk about here with medications. And I want to start with my disclaimer, first of all, that, you know, I'm not a healthcare provider. I'm not a doctor. I'm not a nurse. I'm not a pharmacist. So we're going to talk, what I'm going to present to you today and what we'll talk about is basic information, tips on managing medication, administering medication. I am going to cover the current FDA-approved medications for Alzheimer's disease and the symptoms of Alzheimer's disease, and then some thoughts in terms of resources to rely on when you do have questions. And the number one resource, it's actually two resources, are the healthcare providers that are assisting you in either managing your own diagnosis of Alzheimer's disease or related dementia, or helping you as a care partner to somebody that has received a diagnosis. And so you want to go to your doctors, you want to go to your pharmacists at the local pharmacy that you use and rely on their expertise and their information that they give you based on what your diagnosis is, your specific diagnosis, and all of the medications that you are currently taking. So keep that in mind at all points during this webinar today. So let's get started. And Carrie, if you want to go to the agenda, there we are. We're going to talk about the changes that are going on in the brain with a diagnosis of some type of dementia that is impacting safety with regards to medication. We'll talk about tips and techniques for assisting with the medication management. We'll talk about some questions that are fairly common about the medications that are out there and currently being prescribed and used, and then additional resources. And let's move forward there. So we're starting with the brain changes. So the next slide is going to show us the brain there in the shades of gray. And so you'll see the different lobes, and just to give you an idea of how it is, that's as if a person is, I'm going the wrong way here, facing like this. And so this is the frontal lobe here, and the parietal lobe back here, kind of at the top of the brain, the occipital lobe here, and then the cerebellum and the temporal lobe kind of inside and leading down to the base of the neck. So when we're talking about dementia and we're seeing brain changes, we are seeing brain changes happening all over the brain. Sometimes it may start in one part of the brain and then move, onward from there. And that where it starts in the brain can be different according to different kinds of dementia diagnoses. But overall, what is important to remember is that the damage that is being done because of dementia is really in all of the areas of the brain. So in the frontal lobe and the temporal lobe, this is where we process memory, start to put things into our memory banks. And this is kind of where some of our behavior is governed as well too. And so how does that impact medication safety? Well, if you've got a memory loss issue, then you may be forgetting, did I take my pill today? Maybe I did, so I won't take it, when in fact, maybe you didn't take it earlier, or maybe you take it twice, or maybe 3 times, or maybe even more, because you forget that you took it. And then you forget that you took it a second time, okay? And then just also forgetting, what this pill is for and why do I need it anyways. So And the disorientation, as we've kind of talked about already, that can just lead to all of these problems that can be quite serious if medication is being overused or not taken at all. So that's important to be aware of. And that's part and parcel of most types of dementia is memory loss. With behavior, we can sometimes see apathy, saying, you know, I don't feel like it. I don't feel like moving from my seat right now, so I'll take my medication later. And then if we add in poor memory, then that medication may not be taken. And sometimes we have resistance. If we have a care partner that is asking us or telling us to take our medication right now, a response might be, I'll do it later. I'll do it myself and I'll do it later. So sometimes resistance is what we see. Let's go to the next one. And so then we look at these other lobes, the parietal, the occipital, and the cerebellum. And this is where we're talking about changes in cognition and physical function. How does that impact medication safety? Well, with cognition, it can be the recognition of the function of objects, and it can be problem solving, and it can be sequencing. So how does that impact medication? Well, what it may result in is, I want to give you some examples here, is I've got some props, and this is just a bunch of medications, pill bottles. And if I've got all of these on the table and somebody, either I say to myself, oh, I should take my medication, or my care partner says I should take my medication, first of all, understand that I might not recognize that these, in fact, are the pill bottles. I might be having problems understanding that that's what these are. With regards to problem solving and sequencing, I might be looking at all these pill bottles and saying, well, how do I get started here? And they have some different caps on them and some different instructions on them. And I don't know if you can see different lids with different instructions on how to open them. And I may not be able to kind of figure that all out and see what needs to be done, and to go ahead and take these medications and in what order. So that's when we're talking about sequencing and problem solving. With physical function, of course, there can be loss of dexterity. And so that may mean I'm having problems getting these caps off. And I think we've all had some experiences with that one way or the other with medications and sometimes over-the-counter types of medications. There may be some problems with swallowing as well too, and we've got a narrowing visual field. So let's go to the next slide and we'll look at that a little bit closer. So the changing visual field. So what is happening in people with a diagnosis of some type of dementia is, over the course of time and with the progression of the dementia, we are seeing a narrowing of the visual field. And so here we have in front of us this slide that shows, you know, this lovely scene. There's some mountains in the background and a valley and, you know, nice green fields. Looks like a road going through there, and maybe some kind of farm or outbuilding there that we see. And so we see kind of the whole big picture of this, okay? And we'll go to the next one, Carrie, please. And over this course of time, what is happening is that visual field is getting narrower for people with a diagnosis of dementia of some type. And so what we call scuba view or tunnel vision is what folks with dementia are seeing. So we call it scuba view because I want you to think about having, if you've ever worn a scuba mask to go you know, snorkeling or scuba diving, or just to wear a mask even in a pool. And it cuts off a lot of our peripheral vision. So in the early stages of a diagnosis of dementia, already that peripheral vision is being impacted. And if you'll click the slide, and there in the middle stage, it's narrowed even a little bit more to what we call binocular vision. And click again, Carrie. And middle late stage goes all the way down to monocular vision. And lastly, in the late stages, we see really just a tiny little area of vision. So think again about the big picture we had when we had the whole view of all the mountains and everything in the valley, and then just look at how that gets smaller and smaller and smaller. And as that gets smaller, the visual information is degrading because, you know, the very first picture, it was clearly mountains and, you know, a landscape, mountains and a valley. We could see very clearly what it all was. You can still really more or less tell what it is in the early stage. Even in the middle stage with binocular vision, you would probably be able to figure it out. But really look at the middle to late stage. And, you know, it would be difficult to try and identify what that is if we didn't know already. And so, and that continues, of course, on to the late stage. So that's important to remember, because we could have a pill bottle right here in front of, you know, in front of me with a glass of water for me to take the medication. And with that scuba view, I'm not even seeing the bottle of medication, okay? Or if my care partner puts out the pill for me and puts it, let's say, beside my glass of juice for breakfast in the morning, and again, with that scuba view, I might not even be seeing that medication at all. So that's important to keep in mind just with regards to taking medications, having those visual cues of, you know, reminders to take medication, is that the visual field has changed significantly. And then we'll go on and look at the next, and we'll talk about swallowing. Difficulty swallowing, or a swallowing impairment, is also called dysphagia. And it happens with a variety of different diagnoses, and diagnosis of dementia with progression of a dementia often results in dysphagia. And sometimes it can happen earlier on as well too. Why is it happening? It's because of the changes that are going on in the brain, in the cortical parts of the brain. And what it results in is problems swallowing thin liquids and saliva. And so any of the, you know, water, coffee, juice, whatever it is we might be having gets to be difficult, but even our own saliva, which we do automatically and without thought throughout the day, swallow the saliva that builds in our mouth and in our throats. We don't have to kind of remind ourselves to do that. We just automatically do so. And so now I just swallowed now that we're talking about it. For people with a diagnosis of some kind of dementia, it gets to be something where the saliva builds up. It isn't automatically being swallowed, so it builds up in the mouth and in the throat. And then people are having problems getting it down, okay? So then this may lead to problems like coughing, kind of that sputtering type of cough that we get. And also sometimes to choking. It can result in a choking incident. And so further risks with this type of swallowing impairment, dysphagia, can also include malnutrition and dehydration, and ultimately can result in aspiration pneumonia. Now, what aspiration pneumonia is when, we've all probably done this at some point in time, you know, where you're swallowing something, often a liquid, but it might be some food that we've chewed up, and we say it goes down the wrong pipe. And so then we start to cough, and that's just an automatic response that we start to cough. That's because the food or the liquid is starting to go into, you know, our air, the tube that leads to our lungs, our airways, okay? And so we cough, to get that out, that foreign stuff out of there, so we can breathe properly. And what happens with aspiration pneumonia is some of that liquid and or, chewed up food does actually go into, the bronchial area. And this can cause then an infection that results in pneumonia. And so we call it aspiration pneumonia, because it is a result of this swallowing impairment where liquid or food ends up going into our upper bronchial area and is affecting the breathing. So that's what's happening with dysphagia. And so obviously that's a problem, because if we need to take several medications or even just one, and we're having some swallowing impairment with the water or the juice or whatever it is, and that's a problem already, and now we're starting to cough and sputter, and then maybe the pill kind of gets stuck there in the back of the throat while we're coughing and sputtering, and then that just compounds more problems. So these are important things that we need to be aware of, and they do become more common as there is disease progression. We'll talk about some of the ways to work around this to the best of your ability a little later on this morning. Let's go to the next one. So here we go, techniques for assisting with medications. So next slide. So these are the questions we ask. Is the environment familiar? Next one. Functional? Next. Forgiving and friendly. Familiar, functional, forgiving, and friendly. Next slide. So there we go. This is I think it's a fairly typical table in a home. It's got some things on it. Some people might say it's a wee bit cluttered, but I don't think it's terribly unusual. I think about my own table in our dining room, and it's got much of the same things on it. Right now, I know there's a laptop and an iPad out on mine, and there is a phone, there's a candle, there's some other things. So it's not terribly unlike this one. But what we need to think about is, if in all of that we see on the table, I don't know if you can see as I can, I'll point out where it is or describe, just look kind of in front of the chair that's right at the head of the table. And I'm not quite sure what the little rectangular object is. It looks like it's wrapped in some kind of plastic. But right behind it, you'll see two glasses. I presume they would have water or some kind of liquid in them. And there is a pill bottle next to one of the glasses. And, perhaps this is a medication that needs to be taken. But that would be very difficult for a person with dementia, with that changing visual field, to be able to, and with the disease progression that is changing how information is being taken in and processed, it would be very difficult for many people with the diagnosis of dementia to be able to zero in on that bottle of medication and that glass of water, amongst all the other things that are on the table. So we really need to think about the environments overall, and in particular, the environments that we create when taking medication. That they, are they really functional? Are they really friendly? Are they, forgiving? Do they allow us to accomplish the task in a more in an easier way that is easier for all people, whether you're the care partner or the person taking the medication? So important things to think about. We'll go to the next. So this is what we need to be thinking about in creating a dementia-friendly environment, that it is reasonably uncluttered. And most certainly to, the amount of things that we saw on that table before, if that could be trimmed down by, I'm going to just give you an idea, maybe 75%, that would be really good. So as uncluttered as possible, prepared with only the essential items. And so with regards to medication, that might mean your glass or cup of water. It might mean the pill bottles. It might also mean what we see here on the slide, which is the pill box that is organized by day. So just the essential items with minimal distractions such as sounds, activity, and mirrors. In other words, if there's a TV in the kitchen or the dining room, maybe turn it off when it's time to take medications so there's not that distraction going on. And if it's a busy family environment, maybe just get everybody to quieten down, or if the grandkids or the kids are about, get them to head to another room just for this period of time when you are attending to medication. And that is important either for care partners or people who've been diagnosed, because I'll give you an example shortly about, if we're a care partner and we get distracted and interrupted while we're trying to administer medications to the person with the diagnosis of dementia, we might be the cause of the problem of the medication mismanagement. We want to give people space for movement, and particularly as regards to swallowing. Just think, you're taking what most of us do when we take medication. Put the pills in our mouth, or somebody does that for us. So what do we usually do? We usually tilt our heads back a little bit, open the mouth, and then tilt our heads back and swallow so that it goes down properly. We may need to take a second drink of fluid to ensure that it goes all the way down. We need a little bit of space to be able to do that. And some people sometimes are more comfortable to be standing when they take their medication. Other people are okay sitting. So we need to kind of go with what suits them best. We need good lighting to be able to properly read the label to make sure we're taking the right medication at the right time. And we need a comfortable temperature. If we're too hot, we maybe, for example, we've had some heat going on this week, and if we are a little bit overheated, sometimes we're saying like, no, I don't want to take medication right now because I feel it might make me feel a little nauseous. So too hot. And if we're too cold, well, that might even be something where the hands are less mobile, and our fine motor skills are lessened because of the cold. The hands and the fingers are a bit stiffer. That might mean it's hard to get the caps off. So we need to think about temperature. All right, and then we'll go to the next one. And managing resistance. So there's a great video that this is on a website. I'm just gonna pull my little note over here. And it's at uclahealth.org/dementia. And it's on managing medication. And it's really talking about resistance. And in this video, a granddaughter is going to her grandmother with the pills and the glass of water for grandma to take her pills. And grandma is portraying somebody with Alzheimer's disease. And grandma says no to her granddaughter. She says, no, I don't want to take these pills. I'm not going to take them. And she kind of throws the pill bottle on the floor and kind of tosses the glass of water. That happens sometimes in people with a diagnosis of dementia for a variety of reasons. And so sometimes we need to think about our approach as care partners to getting people to take medication. And sometimes we need to think about the changes we will need to make to do this in a better way. And so what does that mean? That means honoring routine and ritual. So if a person has always taken their medication in the mornings, and that is, the prescription states, the doctor and the pharmacist say, yes, it can be taken in the morning, or, whatever the restrictions may be time-wise, then we would want to incorporate that as routine and ritual for that person as the dementia is progressing, so that part of the morning routine is prior to eating breakfast is that the medications are taken. Now, again, what you have to keep in mind is that, maybe some medications are recommended that you take at bedtime. Some of them are recommended that you take them before or after eating. Sometimes they're recommended to be taken with food. So you have to pay attention to those details. But as much as possible, we want to honor routine and ritual. We want to provide validation and reassurance. And so medication is one of those areas that I think we all just have this feeling, this possessive feeling about it, this sense of autonomy, like I'm a grown adult. I can manage my own medication. I don't need anybody to be helping me. And so we need to honor that while still providing some assistance. So giving some validation and some reassurance to them that, we're saying we understand, that we're listening. Yes, you have always taken care of your own medication, Grandma. I know that. And, I'm just here to be your pill assistant, whatever it is you describe yourself as, to be your person who brings the water for you. I'm going to be your server today, or your personal assistant. So think about the ways that you can listen to them and hear them, validate what they're saying, and reassure them that you're going to do these things together and that you are there to support them, so that you're giving them that sense of autonomy and control over medications. Make the requests positive and action-oriented. So you can say, it's time to take our pills. Let's try this. Which one do you want to take first? This one or this one? That's giving people more control. And what I want to add with it's time to take our pills, in the positive approach to care, how we describe that is we do with, not to, and not for. So I don't give medication to Grandma. I don't administer medication for Grandma. I take medication with Grandma. So maybe I'm giving her the prescription meds while I take a vitamin or an allergy pill. So there we both sit down with our water and our pills and take them together. Give clear step-by-step prompts. It doesn't have to be a big, huge, long explanation. Grandma, you've got to take this almond-sartan amyloid. How often we can't even read the name of the prescriptions. The doctor said you have to have this, and it's for high blood pressure, and the last time we were in, your blood pressure was really high. Too much information. So clear step-by-step prompts. And again, here we go, do with and not to or for. Okay, next. So here we go. Let's take our vitamins, and click again for me, Carrie. And other lies I've told. So what we're talking about here is, what we call therapeutic fibbing, the little white lies. And whether this is something you're comfortable with or not, something that you practice or don't, I just want to emphasize that therapeutic fibbing can be helpful, and sometimes quite helpful. And although you as a care partner might feel uncomfortable with fibbing, lying, to your person with dementia. Of course, that's your own decision. That's part of your, you know, kind of moral character. You need to, only you can make those decisions. You need to think about it and be comfortable with it. And what I will say is that therapeutic fibbing can be useful in order when the bigger picture is looking at the health and safety of the individual, okay? So if it's really important that grandma takes her blood pressure medication and her reaction to blood pressure medication is to throw the pill bottle across the room and say she's not taking anything that doctor prescribes, is it a terrible thing to say, Grandma, I've got your vitamins and my vitamins? And so having got the medication out earlier, not in her view, so she doesn't see the prescription bottle, but rather coming with the pill in your hand, and you've got your pill of vitamin in the other hand, and you give her hers and her water, and then you have yours, and you do maybe a little cheers, and you take your vitamins. So my question is that such a terrible thing? And again, no judgment. People need to do what they're comfortable doing and what fits in alignment with their character as a care partner. And what I will say is, I think the power of therapeutic fibbing can be a great benefit to care partners and to people living with dementia in some circumstances. So, and what I will say for me professionally, after my years of working in memory care, and I'll just put the disclaimer, this was not with regards to medications. Again, I'm not a nurse or anybody who is authorized to administer medications. But with other things, therapeutic fibbing became something that we used fairly widely in the memory care setting I worked in, and it was really useful and oftentimes really had a really positive outcome. So I will leave that with all of you to think about. And we'll go to the next slide. So let's talk about some common questions about the medications that are prescribed. Let's go to the next. Okay, these medications that I'm going to talk about right now are medications that have been around for a while and are frequently prescribed for people with a diagnosis of some type of dementia. And these are for the symptoms of memory and cognition change. So the first ones we'll talk about are the cholinesterase inhibitors. So they help to stop the breakdown of a neurotransmitter in the brain that's called acetylcholine. Now, how does that help? Well, it's a neurotransmitter is a chemical that is needed in the brain for our brain cells to communicate with each other, to talk to each other. And for our memory and our cognition to work as well as it can, our brain cells do need to talk to each other all day long, all night long. And that's, you know, they're talking to each other is what gives our brains function. It gives us the ability to function. So by taking these cholinesterase inhibitors, we're increasing the amount of neurotransmitter that is in our brain. And so these medications are called donepezil, and the brand name for that is Aricept. Rivastigmine, I sometimes stumble over these names, folks, forgive me, but it's just one of my things. I have problems with pronouncing them. Rivastigmine, brand name Exelon. Galantamine, brand name Razidine. So any one of these medications may be prescribed to a person to, again, help with this, kind of increasing the amount of neurotransmitter that is in our brains, allowing the brain cells to talk to each other more efficiently. And then another type of medication that is, I'm not even going to attempt to say that one. It's an NMDA, that I can say. Antagonist that regulates glutamate activation. And please don't ask me to explain all of that because I am also not a scientist or a research scientist. And honestly, all I can tell you is that it's working in the brain in a different manner than the previous medications. And its generic name is memantine, brand name Namenda. So over the course of research trials, clinical trials, researchers came to find out that people who were on one of these cholinesterase inhibitors and then went on Namenda, so the combination of the cholinesterase inhibitor and the Namenda had, enough better function than people who were just on the one cholinesterase inhibitor. And it was significant enough in research terms, in scientific terms, that it became kind of a protocol for many patients with a diagnosis of dementia, that physicians would prescribe, for example, Aricept and memantine, Namenda, Aricept and Namenda, and that folks, did well, tolerated it well, and it was even more of a increase in cognition and, in other words, better cognition and better memory when they were on these two medications versus just the one, say, Aricept medication. So, and then over the course of time, of course, the pharmaceutical companies put their heads together and they came up with the combination medication called Namzaric. And all it is one pill that has both the Aricept in it and the Namenda in it. And it's a time release medication. And so, a person could take Aricept and Namenda just as two different pills, but they could also, an alternative would be to get the one medication, Namzaric, that is the combination of both and is a time release. I hope that's reasonably clear for you, all of that. So these are the very commonly and currently prescribed medications. Important information here is these medications treat the symptoms, okay? They don't slow the progression of the disease. They don't cure the disease. They don't stop the disease. They treat the symptoms. And oftentimes what we hear from people with a diagnosis of dementia that have been prescribed these medications is that they do feel like there's kind of a fog lifted and that their thinking and memory is a little bit clearer. And this is not something that goes on forever. It's kind of time limited. These medications are most effective in the early stages of a dementia diagnosis and are time limited in that at some point, usually in the middle stages of the disease, they really are often not contributing any positives to a patient. And it may be a physician may decide at that point in time to take the person off of the medication. So keep those things all in mind. And then let's go to the next slide. So these are the new medications. So you probably have heard about ElderHelp, also known as aducanumab. That's the generic. Now you can only get ElderHelp as a brand name medication at this point in time. This was a medication that got kind of a FDA fast track approval, and then there was all sorts of controversy about it. And some of that has been looked at and ironed out a little bit. So it has received FDA approval for mild dementia. However, it is a limited approval, and it is limited to patients in clinical trials. The benefit of this medication has been a part of the controversy. So there does appear to be benefit. There is question amongst researchers as to whether it's significant enough to, warrant it being a newly prescribed medication. There are more clinical trials still ongoing in it. The consensus amongst researchers was that more data was needed to really show whether this medication is helpful or not. It is administered by IV infusion every 4 weeks. So this is not a pill form. You have to go in to, wherever it is you go to, your doctor's office, and receive it as an IV infusion. One of the other controversial parts of this new medication, ElderHelp, is that it can have significant side effects. And what those side effects were is brain bleeds, and sometimes some quite serious brain bleeds. And so because of that risk factor of brain bleeds, this also has contributed to it having only limited availability to people in clinical trials, pending further research and outcomes of clinical trials. So additionally, this medication is only covered by Medicare if the person is enrolled in approved studies of the drug, okay? So this medication is, not widely prescribed. A lot of the doctors that we work with at Alzheimer's San Diego have indicated they won't prescribe this medication for their patients until there's more data, scientific data on the clinical trials. So that's ElderHelp. And the next slide. Now this is the latest new medication, lecanemab, the generic name. And this has received full regulatory approval, and it is also indicated for mild dementia and MCI, mild cognitive impairment. It's most effective for those early stages of a dementia diagnosis. This medication slows the progression of Alzheimer's disease and MCI. And the same is true for the ElderHelp. So the significance of these two new medications is that they are not just treating the symptoms, these are disease-modifying medications, okay? So they are slowing the progression of the disease. And to be clear though, they don't stop the progression of the disease, nor do they cure the disease, but they do slow the progression. This lecanemab, like the ElderHelp, is an IV infusion every 4 weeks. And the pharmaceutical company that manufactures this drug has put a boxed warning on the medication because of the risk of side effects, which is similar to ElderHelp, that it could be brain bleeds, but it doesn't seem to be as significant a risk as has been documented with the ElderHelp. This medication is Medicare approved also, and but it's not restricted to people who are only in clinical trials, so it's widely available, Medicare approved. So those are the two new medications that are disease modifying, which is really a hugely significant step forward in terms of the medication options for people with the diagnosis of dementia. And, is going to help already has helped spur more research on, so that we can hopefully make even greater gains in new medications that can really slow or stop the progression of Alzheimer's disease and mild cognitive impairment. We're not there yet, but these are definitely the first steps. And so those are the new medications. And what I will say is there is another medication in the pipeline. So in the research pipeline and the clinical trial pipeline, that is in phase 3 clinical trials, which means it's getting close. And there is hope that it may be FDA approved later this year. So keep your eyes and ears on the news as we go on in the year with regards to possible new medications for Alzheimer's disease and mild cognitive impairment. All right, next slide, please. So there's all sorts of dietary supplements out there, and you name it, it's out there. Everything from, yes, vitamin E, ginkgo biloba, resveratrol, omega-3s, vitamin B, anti-inflammatory agents, all sorts of other things too. And really the bottom line with regards to dietary supplements is talk to your doctor about anything you hear about or have interest in, to see if it's something that your doctor either suggests you take or feels it's, at the very least not going to do you any harm if you decide to take it. It's really important that you do that all of us do that. There are, diagnoses, and I'm not necessarily referring to Alzheimer's disease, but other diagnoses that we can have that makes us more sensitive maybe to taking some of these supplements, or that would not be recommended for us. So we need to really go into this with eyes wide open and with as much information as possible. The other thing I will say is there's lots of supplements that are advertised and for sale targeting, you're going to improve cognitive function and improve memory. And I just urge everyone to be very cautious with that and to be an informed consumer and do your research. Some of these supplements are very expensive, and many of them don't work. They don't do what they promise to do. And so you have to be very careful with this and understand that supplements don't go through the rigorous scientific evidence that needs to be proven to the FDA before it gets that approval from the FDA. Supplements don't have to go through that rigorous scientific procedure. They're able to, anybody can kind of make any supplement and advertise it and sell it for $40 a bottle and say that it will improve memory, and not have to go through that rigorous procedure for approval through the FDA. So that sets all of us up to be potentially kind of taken advantage of. And especially when we're talking about a diagnosis of some kind of dementia. I mean, I think if it were me or somebody I love and I didn't know what I know and didn't work where I work, and I saw an advertisement that says it's going to stop memory loss and improve cognition, well, yeah, I'm interested. We're vulnerable when we have a diagnosis that has such significance as a dementia diagnosis does. We are looking for answers. So I just really want everybody to be aware, to be cautious, and to be a savvy consumer, and talk to your doctor. about these supplements that are available. All right, next. There are medications that are prescribed for behavioral symptoms, usually in the middle to middle late stages of a dementia progression. And it might include anticonvulsants or antidepressants. Actually, an antidepressant may be prescribed earlier on and oftentimes are and can be very effective for people in the early stages of memory loss. Antipsychotics, that might be something tending to be prescribed if needed, more in the middle to middle late stages. Anxiolytics, means anti-anxiety medications. And again, that's something that may be prescribed early on, that might be used throughout the course of the disease. And then sometimes sleep aids. You know, anytime you or the person that you might be a care partner for are having behavioral symptoms, and by that we're talking about a change in behavior that is different from their normal personality and behavior. Just more agitation, angry, combative, upset, crying, and anything that is just kind of different from normal. You always want to talk about these things with the doctor. So it may be a symptom of the dementia disease that person has been diagnosed with, but it may also be something else that's going on. It might be an infection, it might be pain, could be all sorts of different things. It's really important to talk about these things with the doctor, and then the doctor will be, as is appropriate, looking at medications that may help with some of the behavioral symptoms. We'll go to the next one. We all, I think, probably at least once in our lives have been guilty of acting as if we are our own doctors or pharmacists, you know, where we maybe cut a pill in half because we don't think we need as much a dosage as has been prescribed, or we just take it differently than has been prescribed to us, or we might crush it and put it in some applesauce to give to the person that we want to give the medication to. All sorts of different things that we do sometimes. And the bottom line here is really we should not do this, and please do not do this. Take the medication as it has been prescribed to you. And if you've got concerns of any type, you can talk with your doctor, but also go to your pharmacist. Pharmacists are vastly underused specialists that have great knowledge and can really give us some good guidance. And you know, we don't even have to schedule a doctor's appointment. We go in, we ask to speak to the pharmacist. So the pharmacist can answer questions about the necessity of the medication, the dosing of it, whether, you know, it could possibly be taken, let's say, once a day versus twice a day, or vice versa. They can answer questions about the time of day. You know, is it important to be taken at a specific time of day? And they will also give you guidance about the format. Now, not all medications should be crushed. Some of them, they specifically say do not crush. And it's because they're a time release medication. And so they need to stay kind of in that form for an extended period of time. So that's just dissolving. The medication is entering the system slowly over a course of time. Certainly some capsules are not intended to be crushed either. And if crushing is something we're interested in, there may be a liquid form of the medication that, you know, we could be getting as the prescription instead of in the tablet form. Sometimes a substitution may be advised. And again, you can talk to your doctor or pharmacist about that. And, with incorrect dosing, we need to adhere to the medication, the dosing as it is prescribed. And if we have questions about that, again, talk to these experts, because incorrect dosing could potentially result in some real problems. We'll go to the next one. So for storage and disposal, keep medications in a dry, dark location. Think about safety and access. Adhere to expiration dates as well, and I'm referring to over-the-counter medications also. Tips for safe disposal. Most pharmacies do have a medication disposal bin that you can use, but there's also prescription drug drop-offs available through the San Diego Sheriff's Department. And so think about those things. And actually, I was just going to tell you real quick, like in our house, I take medication, my husband takes medication, and actually one of our dogs takes medication too. And we have a little drawer that the medication sits in. And one day, my husband came to me in the morning and he said, I think I just took the dog's medication. And so we kind of investigated, and in fact, he did take the dog's medication. But look, I'm kid you not, this is the dog's medication. I don't know if you can see. There's pictures of animals on the lid. But look, it just looks like one of the other medications, right? And all of us take ours in the morning, and sometimes we're not quite awake in the morning, kind of bleary-eyed. And so he did take the dog's medication. Now, thankfully, there was no side effects or repercussions for my husband, but that was a clear lesson for us that the location of the medication needed to be, each person and dog that is taking medication needed to have their own specific area in the drawer. So we ended up partitioning it into different areas so that each of us has our own partition that we put our medication in. So think about those things too. And next slide. Oh, there we go. I got a little ahead of myself there. So, and look at, some of the pill box, weekly by day, and sometimes by time of day, little boxes that you can set up and have that all ready for you, so that there's Monday, you flip it open, you take the medications that day or that morning or that afternoon. There's other more complex reminder systems too that are, battery operated or plug in, and they'll automatically rotate and open a little slot with the medications. Some of those systems people do like to use. They can be helpful. And, ultimately what I will say is, for all people with a diagnosis of some type of dementia, at some point, and earlier rather than later for safety, are going to need oversight in taking medication, and ultimately are going to need personal assistance with it, okay? Again, think about swallow precautions, particularly with some of the medications that are larger. For example, some of the omega-3s, larger, and they can kind of have that sticky coating on the outside. Pill can get caught in the throat. So, be aware of those things. And again, the dosing and the timing. Next one, please. Think strategically, give the most important medications first. And if you don't know what the most important ones are, talk to the pharmacist. Consider what is the person's best time of day. If the medications can be taken at any time of day, when would it be best and easiest to give medications to a person? Maybe that might be for one person at noontime. For another person, it is the morning. Think about those kind of things. Watch for hiding or pocketing. When we're talking about pocketing is when it can literally sometimes, I guess, mean putting in your pocket, but often what we're referring to is pocketing in the sides of inside the mouth, tucked in between the teeth and the cheek. Now, sometimes that happens inadvertently. It's not somebody trying to hide the medication. It's just the pill slips back in there, and the person is either not aware that it's back in there, or they're not able to fish it out with their tongue. So watch for that. Or, that some people may, that's how they deal with not wanting to take medication, is to hide it, wrap it up in a little piece of Kleenex and put that in their pocket. So watch for those things. Next. Think about the interactions, and again, talk to the pharmacist and the doctor about this. And that can be side effects, and that can be the use of alcohol. There is a list called the Beers List, and you can get this through the American Geriatric Society. If you just Google Beers List, you'll be able to get it. And it gives medications that may be contraindicated for older people because of the risk of adverse effects. And, what I want you to think about also is over-the-counter medications, because, for example, some of the medications we may use for colds, some of the medications we may use as sleep aids, some of them have a real sedating effect. And for a person with dementia, some of those over-the-counter medications can really exacerbate the symptoms of memory loss. So they make memory loss and cognition worse. And, there's other medications that can just, again, have adverse side effects for people with a diagnosis of dementia. So anytime you're going to look at using over-the-counter products, medications of any kind, and or use of alcohol, talk about that with the pharmacist and or with your doctor. Oftentimes they will say right on them, let's see, well, none of these ones I have here say, but they'll say, oh yeah, may make you drowsy or dizzy. Check with doctor before drinking alcohol. Use care when operating a vehicle, vessel, or other machines. Pay attention to that. And talk about if you like to have a glass of wine with dinner. Just check with your doctor. Is that okay, given the warning that is on that medication? We'll go to the next one. Resources for additional help in the next slide. Just know when it's time to ask questions, time to get additional information, have a safety net, use your pharmacist, please, please, please. These are just, again, the most underused experts that are available to us. Think about professional in-home care. Think about other resources such as speech therapy. That can sometimes help with swallowing problems. And think about respite for yourself as a care partner. And next. There we are, all the things we do at Alzheimer San Diego. All great things. And the number one thing I would say with regards to today's topic of medications is call us. We have our clinical services team answering the phones 8:30 to 4:30 every day during the week, Monday through Friday. And you can direct your questions to our team with regards to today's topic, but as also with regards to anything that you have with questions. Now, again, we're not pharmacists or doctors or nurses, so with regards to specific medications, we can't advise you, but we can give you tips on maybe how to approach the person in a different way to have them take their medication. That kind of thing we can help with. That's what we're here for. All our programs and services are at no cost to the community. And we really, that's why we're here, is to support you, inform you, educate you, and be part of your safety net. So please do contact us. Now, I've really talked here. We've got just a few minutes. Let's see if we have questions. Carrie, you want to join me?
Yes, thank you so much, Jean. I always learn new things from you, but I think that you shared a lot of really helpful information about medications and managing and understanding how a person changes throughout the disease process. So hopefully that will help our attendees understand with their own family situations and loved ones. So let's see if I have any questions. I think the one question, well, I had some comments about how helpful the information was, so thank you for that. And then one question came up about the oxygen, hyperbaric oxygen therapy treatment, and if you are familiar with that being recommended to help with preventing and improving the brain and the symptoms. So it sounds like there might be some information about that preventing earlier on.
I really don't have any information or insight into that. Okay. I would recommend directing that question to your doctor, okay. Because you'll get, based on your situation, your diagnosis, the medications, etc., or for the person you care for, the recommendations one way or the other with regards to that.
Okay. Thank you for that. And if anybody else has any other questions, please definitely type them in now, and we're happy to answer those. Just another comment coming in that this was great information and especially helpful with the vision slides and the swallowing risks, including the accidental taking of the dog medication. So that example was helpful. So thank you, Jean.
It can happen to any of us, right?
Yeah, all of those situations are learning experience.
Yeah, absolutely. I do want to share one last resource, and maybe you could pop this into the chat for folks. Carrie, there's many pharmacists. They're actually geriatric pharmacists. That's a particular board specialty for them. And this lady, I don't know if you can see her picture. She is Dr. Stephanie Mattenpour, not a medical doctor, but she has her PhD in pharmacy and is a geriatric pharmacist here in San Diego County. And she has a company that she started that is, I want to make sure I've got it right, and it is a .org.
Okay.
And it's called, where did I go? Here it is, www.pillbox Talk. That's PILLBOX TALK. It's .com. My apologies. And she is just a really knowledgeable person with regards to medications and seniors and dementia. And if I remember correctly, and I think I do, if you go to her website, you'll see that she does have some services that are at no cost to be able to give people some guidance and advice. And so there's another resource for all of you.
Wonderful. And then if you, Jean, would be able to send me the link for that video that you referenced through UCLA, yes. And I will send that out in my follow-up email to everybody.
Very good. I will do that. I've got it right in front of me, so I'll do that.
Wonderful. Thank you. And I just wanted to mention that we are going to have a webinar. We're not going to have one in August, but in September it will be safety related. And then in October, we'll be back here with our partners at Alzheimer's San Diego talking about communication skills. So that will be a really helpful topic. So
Yeah.
So please join us back here. And I wanted to mention that the Caregiver Coalition of San Diego, both of our organizations, ElderHelp and Alzheimer's San Diego, are members of this coalition, and we're all working together to support family caregivers in our county and beyond. But there is an upcoming webinar through the coalition taking place next Friday, July 28th, and it's on the topic of making the most of your doctor's visits. So I will share that information in my follow-up email as well, because I think the topic is kind of a good follow-up to today's topic that we talked about with medication. So I will
Very
share that for everybody to have. And I'll leave it on this final slide that has ElderHelp's contact information. So if you have any general questions or missed anything, please feel free to reach out to us, and we're happy to get you connected. Just as a reminder for everybody, I will send a follow-up email with the link to the recorded version of today's webinar. So if you have somebody in mind that could benefit that wasn't able to attend, please share it. It will also be housed on our website, on our family caregiver page. We have a webinar library where all of our previously recorded webinars live. So you're welcome to access those at any time and share them with others if they are looking for resources as well. So I'll send a follow-up with all of the information that we talked about and that Jean referenced in the presentation, as well as Alzheimer's San Diego's contact information. So you'll have everything in one place. But I don't see any other final questions. So Jean, I just want to thank you again for your time today and your expertise and on such an important topic. So thank you.
You're very welcome. Always happy to partner up with you folks at ElderHelp, Carrie.
Thank you so much, and take care, everybody. I'll be in touch soon with the follow-up email. Thank you.
Bye.